Hi, J.R. Lewis with you on KLIM and KCDV, Wednesday, October 7th. And for those of you who heard our earlier briefing today, this one is an update because, unfortunately, some things are on the move. So we're going to cover that here for our 5 p.m. and 8 p.m. updates on Wednesday the 7th. This will go up to the YouTube channel, youtube.com/Cordova TV. So we'll just run down the press release here for the sake of time, and we are now up to 4 positive COVID-19 cases in Cordova. If you check the dashboard, it still says 3 and condition green, at least the last time I looked at it. I don't know if they'll update that before the usual cycle when they change it, but this is based on a news release we got right from the city manager. 4 positive COVID-19 cases in Cordova right now. The city of Cordova reports another positive today, that's the 7th, in a resident. This case self-presented to a local testing site with symptoms and indicated contact with a positive case identified earlier in the week. With the identification of 4 cases within the last week, the medical response team feels it's necessary to move to a level 3 alert to raise citizen awareness of their need to follow COVID-19 prevention protocols. Cordova testing is available at CCMC and Alanka Clinic at the same set hours that they've had here recently, and Cordova hospital capacity remains good. The medical team emphasizes they don't want this to be a cause for alarm, but as an opportunity to remind everyone to be cautious. And in order to accomplish that, Cordovans are urged to do their part to keep the community safe. First, there's what they call the 3 W's: wear your mask, watch your distance, and wash your hands. Then they talk about avoiding the 3 C's: crowded places, close contact settings, and confined or enclosed spaces. So that's basically some mnemonic, I guess, for social distancing and mask wearing largely, and hand washing. It says keep contacts limited and social circles small, avoid indoor gatherings, keep track of your contacts to aid with contact tracing should you test positive. Don't ride in cars with people who are not in your household bubble. Limit your errands and outings. And while it doesn't say so, I would imagine using takeout services would be a logical extension of that, because they're things you are going to need, obviously. So take advantage of all of the businesses offering takeout or possibly delivery. Watch out for COVID-19 symptoms and get tested even if you have just 1 symptom or mild symptoms. Consider getting tested 5 to 14 days after any possible exposure. Goes on to say don't be around others. If you're not feeling well, stay home and isolate immediately. Don't wait, isolate. If you test positive, let any close contacts know so they can protect others. Quarantine quickly if you're exposed to COVID-19 for a full 14 days. And protect our health system by staying safe following these protocols and getting flu shots. Because, of course, if we have serious influenza cases on top of possible growth in COVID cases, that's going to easily overwhelm our hospital, so we don't want to see that happen. There is, of course, the possibility that there will be some more cases come out of this sort of cluster that's growing, and we'll keep you up to speed on that. But and I would imagine we'll talk to Dr. Sanders for tomorrow's briefing, but for here on the 7th, we'll call that good. Again, on the radio in the 1, 5, and 8 p.m. hours on KLIM and KCDV. And when it's not just generic information, these also get uploaded to youtube.com/Cordova TV. So that's the information for right now, October the 7th. Use covid19.cityofcordova.net for the most current information in general. Again, I don't think the dashboard has been updated, or at least not at the time we're recording this for you. It has not been updated to include the fact that we're up to 4 active cases now. 3 residents, 1 non-resident. And it kind of sounds like they are connected to each other. So again, I would expect we'll hear from the doctor tomorrow. We hope you continue to stay safe and follow the protocols. so we continue to be successful in dealing with this here. And with that, we'll get back to regular programming on the radio, KLAM and KCDB.